All right. Well, welcome to the third and final edition of Chapter 3. This one happens to be one. I said this about sleeping, but I'm going to say it again about drugs and addiction. It seems to be a lot of people's favorites. When I teach this same type of lecture for Psych 2, for those interested in biopsych, it goes even deeper, and people are very, very interested in it. So let's move right into it. When we talk about states of consciousness, we lose consciousness when we're sleeping and those other things. And drugs, um, which is basically anything that your body doesn't make, something that is outside of your body, that when you ingest in some way or put it into your body, it changes your functioning. Specifically for psychology, we talk about how it changes our brain functioning by causing neurotransmitters to increase or decrease, or to change certain things like that. So we are effectively changing the way that our chemistry, our brain and body chemistry, is going. Today we're going to be talking about drugs. We're going to talk about the classifications of drugs, and we are going to be discussing, or at least I will be discussing, addiction. When a person first takes a drug, the drug works at its own area, meaning alcohol works on those GABA receptors. So GABA is the inhibitory, causes an increase in GABA, which shuts down your system. Things like caffeine or nicotine in cigarettes, or harder, more potent stimulants like cocaine cause you to have more energy, a bit of euphoria, and ramp up your system as opposed to ramping them down. And we have things like marijuana and things like LSD or acid that cause the sensory neurons to, quote, trip, quote, and give more information than is actually there in the real world. So when our brain interprets it, we may see things like color trails, or pictures may come to life, or things like that. So those drugs work on their individual systems. With hallucinogens, most of those, like acid, are serotonin agonists. With alcohol, it's a GABA agonist, which starts to shut the system down, um, and things like that. But they work at those receptor sites. They work at GABA, at serotonin, at dopamine, at norepinephrine. But the one thing that these have in common is that once those are evoked, they also send dopamine into that reward center of the brain. We call that the nucleus accumbens. And we talked about this a little bit in chapter 2 when we went over the neurotransmitters in the brain. And dopamine, we said, or I said, was involved in the addiction pathway. Well, that is from the middle of the brain to that reward center, right, basically in the area of the hypothalamus called the nucleus accumbens. And that, the drugs themselves make people feel, however they feel, gives them a good feeling. And that's working where the drug is doing it. But what the dopamine spike is doing is it's telling our brain, oh, not only does this feel good, but we really like this. And it reinforces or backs up that feeling. And so when you take the drug, it works at its level. So again, let's just use alcohol as an example. Or actually, I guess I can use heroin as an example, because that will come up later. Not doing heroin, but my example. So you do a unit of heroin. It's actually something like milligrams per kilograms that you inject, but we'll call it units. You do 1 unit of heroin, and it causes your opiates to increase, your endorphins in your body. So it calls up all these great endorphins, and people get a lot of pain relief and euphoria, this great happiness. So it works at the opiate receptor sites, and it spikes dopamine. And you take your heroin again, and it works at the receptor sites of the opioids, and increases endorphins and blocks pain. And then it spikes dopamine into the pleasure center, or reward center. So we like the effects of the drugs, and now this is reinforcing to our brain that we want it. Eventually, what happens is Your brain is going to not just say we want this drug, but that we need this drug. And in fact, when this process of addiction happens, um, you are then listening to your brain, because your brain will actually start to, once the cycle continues, your brain will actually spike dopamine first because you are expecting to get this drug. It's now part of your routine. It's now part of who you are because your brain is in charge of everything you do. And your brain is now saying, we don't just want this drug, we need it. So good luck trying to get away from that. People in the 80s and maybe even in the early 90s and any time before that used to say that people who were addicted, it's just because they didn't want to stop. Maybe they didn't realize how harmful it was or things like that. No, this is your body and your brain, which is, as we've already established, in charge of every single little thing or big thing that you do. And this is your brain saying, we don't just want these drugs, we need them. So really, I say good luck trying to just up and quit, because your brain is telling you different and your brain is controlling everything you do. So if we look at this um, definition of addiction, we see it as the compulsive craving of drugs or certain behaviors, which I'll get into in a second, such as gambling, eating, sex, internet, right? Things like that. Gaming could be anything that you could compulsively do, despite known harmful consequences. So what this means is, you know, your people who are addicted to drugs are not dumb. They know it's hurting them physically, that it's breaking down their body. They know it's hurting them mentally, could cause depression and things like that because they can't beat it. They know it's hurting them socially. They can't keep a job, stay in school, stay married, keep friends, because their whole day, their whole life now is consumed by this. And that's what it does, is it takes over the brain and makes the brain think that it needs it. So it's not like they don't know that it's hurting them. Some of the words that we have that are associated with addiction are tolerance and withdrawal, as you see here. With tolerance, that just basically says that your body or your brain is getting used to the amount of dosage. So if you've ever had a drink of alcohol, maybe when you were younger, again, I don't judge, and now I can't even see any of you guys. So I would never, tell on you. But if you did, it probably didn't take much for you to get drunk, maybe one beer or one drink or something like that. And then as you get a little older, get a little better at it, have a little more practice, with repeated use, the desired effect requires larger doses. So in this case, if you started out, I'm going to go back to my heroin example. Sorry. You start out with 1 unit of heroin. So let's call your drug dealer Doug. Doug the drug dealer. Doug the drug dealer says, why don't you try this? The first one's on me. So you try 1 unit of heroin, and oh man, is it effective, right? Don't do drugs, kids. But it's really effective. So your 1 unit of heroin makes you really high and really pain-free and really euphoric. And eventually, after a little bit, after a few times, 1 unit is just not enough. It does not give you the same high that it did the first couple times. So you need to up your dose. This happens with over-the-counter medication. This happens with prescription medication a lot of times. The amount that your body is used to is not going to be enough to produce the same effect. So eventually, you may have to go up to 2 units and double that dose of heroin to feel the same effects you felt the first time with just 1 unit. And eventually, you may even need to go up to 3 units of heroin to do that. So not only is it getting dangerous because you're increasing the dosage, it's becoming expensive, right? So what tolerance means is with repeated use, the desired effect requires larger doses. Now, if you're a pro at drinking, it may take a few shots and a 6-pack of beer to get you drunk. Not at the same time, because that would get you probably pretty gone. And withdrawal is another effect of addiction, because once your body starts to crave it, once your body starts to get used to the new normal of always having that drug, if you don't take the drug, your body's going to react. So withdrawal is defined as a discomfort and distress that follows the discontinuing of an addictive drug or behavior. Um, that's what makes you crave it, is that dopamine spike into the reward center of the brain before you even take the drug. So it makes you crave it. It makes you want it. Um, and if you don't get it in a certain amount of time, your body doesn't know how to respond and your brain doesn't know how to respond. So what it does is basically exactly the opposite of what the drug does. So if it's heroin, which is very big pain relief, the withdrawal symptoms are going to be the opposite. You're going to feel a lot of pain. With alcohol, it slows down your system. So what is it going to do in the absence? You're going to get shakes. Your system's going to ramp up. You may get a lot of anxiety. And you're going to have too much glutamate in your brain because remember, it's a lot of GABA. So now you're inhibiting GABA, and by default, you're increasing glutamate. So here is a fun fact. Or I was going to ask the question, but I'll have to answer it myself because I'm the only one talking now. Do you think, and I'll just let you think about this for 10 seconds, do you think it is more dangerous to withdraw from heroin, which a lot of people die from an overdose, or do you think it's more dangerous to withdraw from alcohol? We'll sit with that for a second. I'll let you think about it. And now I'm going to reveal the answer. It is actually more dangerous for you to withdraw from alcohol than it is from heroin. And why is that? Well, I'm glad you asked, kind of. Because nobody has ever died from pain. Pain may make people pass out, but no one's ever died from too much pain. Pain is our body's natural alarm system. So heroin is a big pain reliever. And the opposite, discomfort and distress that follows, is a lot of pain. And although pain sucks, it's not going to kill us. Whereas with alcohol, as we're going to get into, you are shutting your body down by increasing GABA and making yourself sleepy and shutting down the CNS, central nervous system. If you withdraw from alcohol, and this is why I always tell people who are alcoholics or have families with alcoholics that it is actually much safer to ramp down and wean off of the drug or off of the alcohol, still a drug by definition, wean off of alcohol as opposed to trying to quit cold turkey just because of the shock to the system. If you continue to ramp down your use, it's a lot safer. If you do not, then too much glutamate, right, in the system that we've talked about in chapter 2 as well, can lead to seizures, and seizures could absolutely kill a person. So it is actually more dangerous to withdraw from alcohol than it is to withdraw from heroin, even though you may not think that conventionally. Now you know, kids. So when we talk about tolerance, withdrawal, and addiction, how do they play a role? Well, it should be pretty easy to sort of fill in the blanks or see the circuit here. If you have a substance abuse disorder, people who are addicted to drugs are unable to control their behavior. Remember that prefrontal cortex that allows us to make decisions, think about things, coordinate our senses, all of that? Well, you are diminishing function of the prefrontal cortex in the frontal lobe. So these people may exhibit impaired control over their emotions and control over their behavior, social disruption, very risky behavior, erratic behavior, and of course, we have the physical effects of tolerance, taking more of the drug just to feel the same high, same level, and withdrawal. If they don't take it in a certain amount of time, it literally causes them pain or discomfort and distress. So the drugs that we're talking about are what we call psychoactive drugs. And those are drugs that alter our perceptions, they alter our moods, they alter our functioning of our brain. So they may produce, again, tolerance. So it requires larger doses to achieve the desired effect. If we go back to the example of heroin, 1 unit, 2 units, and now maybe you're up to 3 units of heroin. And if you don't get that heroin in a timely manner, according to your brain, withdrawal symptoms, significant discomfort, accompanying attempts to quit or to hold out. So you're going to be in a buttload of pain. If you continue use, it used to be that it worked at the sites of the opioid receptors and then spiking of dopamine. If you become addicted, you're compulsively craving the drug, so your dopamine is spiking first before you get the drug or certain behaviors, despite knowing adverse consequences. Now, one thing that I just pointed out is that there are other things: gambling, food addiction, sex addiction, gaming addiction, anything that really can be too compulsive. Your brain, it's not a chemical dependency, so it's not working at GABA, opioid sites, serotonin, norepinephrine, right? But what those compulsive behaviors have in common with drugs and alcohol is it does spike dopamine into that pleasure center. So if you hear people dismissing it, well, drugs, of course, because it's chemical dependency, but you can't be addicted to food. You don't think sugar is a chemical? Does it change the way that your body reacts? It increases blood sugar. It does a lot of things, right? Yeah, certain foods with chemicals, right, or all foods really, can cause addiction. People who are morbidly obese, that's part of what they're dealing with. That's their own addiction. It's just not what you think of as a hard drug. In 2009, Tiger Woods' wife took one of his famous golf clubs and beat out the back window of his car, of his SUV, because she found out that he'd been cheating and his with a lot of women. His excuse at the time, which could be completely real or be completely made up because of his persona, was that he had an addiction to sex. Well, um, orgasm changes your um, composition. It causes changes in the brain. It releases endorphins, of course, not to the same degree or magnitude as opioids, but there are changes there, and people could become addicted to that. And of course, you're spiking dopamine. So could he have actually had a sex addiction? Absolutely. Could he have been making the whole So continued use may lead to addiction, which is the compulsive craving of drugs or certain behaviors: gambling, sex, gaming, internet, shoes, right? Food, any of those things that you seem to be unable to just quit so easily. Um, despite knowing that it's bad for you, you know it's affecting your relationships. You know it's affecting your ability to work or go to school. You know it's affecting your physical health, and yet you just can't stop because your brain is in charge, and your brain doesn't just say we want this. Your brain says we need this. So when is drug use a disorder? When it gets out of control. If you have diminished control over your behavior because your brain is taken over and your frontal lobe, prefrontal cortex, is sort of inhibited or shut down a bit, you use more of the substance for longer than intended. So there's your tolerance. Trying unsuccessfully to regulate the use of the substance. You spend a lot of time either acquiring, using, or recovering from the effects of the substance instead of, doing the normal things you do every day, sometimes at the risk of eating or sleeping or things like that. And of course, because your brain spikes dopamine first when you're addicted now instead of the other way around, you then crave the substance. This is an effect we call classical conditioning, which we're going to get to in the next chapter. Socially, you're diminished. Your commitments to work, to school, to home, family, friends. You can't do the things that you used to do because you're spending all that time. Look at number 3, acquiring, using, or recovering from the effects. It continues despite knowing that you have problems, knowing it's affecting your relationships, knowing it's affecting your friendships, your ties to your family. And it causes you to pull out of things, right? Reduce social, recreational, work activities. You're no longer going to the gym. You're no longer going to happy hour with your friends, unless maybe it's an alcohol thing and you're trying to disguise it, if you can. And you're no longer going out with people because, again, go back to number three, acquiring, using, recovering from the effects. Hazardous use. You know it's hurting you physically, mentally. You can't do anything about it. Your brain's in charge, and your brain's saying, we need this. And it continues despite worsening physical or psychological problems. You may get depressed, you may get anxious. A lot of things could be happening because you know that you're stuck in this sort of loop because your brain is in charge and it's telling you we need it. Of course, the drug action itself, experiencing tolerance, now we're very familiar with that, needing more of the substance for the desired same effect. You're now up to 3 units of heroin from your original 1 unit. And it's depressing. And of course, if you tried to stop, your brain would be like, no, 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 we need this, and give you the opposite discomfort and distress in the form of withdrawal symptoms. So, the concept of addiction used to be that people liked it. It was a matter of willpower. And, you could stop anytime you want. You just don't want to stop. You're not motivated to stop because it feels good. So the degree and scope have been debated. First, when the neuroscience came in and we realized that it was having a hold on your brain, they said, well, okay, I can understand that it's chemical, right? It's causing your neurotransmitters to go out of whack. It's causing dopamine to spike into your pleasure center, reward center. But that's drugs and alcohol. There's no such thing as being addicted to food or gambling or things like that. So the degree and scope have been debated for a long time. In the court system, they threw a lot of that out and they just said, oh, if you're on drugs, that's it, you go to jail. People went to jail for life, pretty much, just for having a little bit of marijuana in their pockets or on them. So nowadays, thank goodness, with the advances in neuroscience and studies and psychology, addiction is seen as a disease needing treatment because, as you know now, it takes a hold of your brain. So it is a disorder. It causes a change in the way that you function. It causes a inhibition of your prefrontal cortex. It causes a lot of different changes. So it is now seen as a disease that's needing treatment, and not just for chemicals, right? Now we see sex addiction. We see food addiction. We see a lot of other things, right? Gambling, Gamblers Anonymous, right? There's a lot of those companies or programs out there. So now it's offered for many driven excessive behaviors that can become compulsive and, of course, dysfunctional and disruptive to your life. In 2013, the American Psychological Association even talked about further study of internet gaming disorder, and we know that that's true. If you don't believe me, go to YouTube and look up teenagers whose parents take away their gaming systems. When I was a kid, we didn't have online. Now I sound old. And we just played video games on our own without being connected to other people. Now, a lot of the allure of the PS4s and the Xboxes and all of that stuff is not only do you get to play the game, but you can play online with your friends or people that maybe become your friends as you meet them online. And when you take that away as a punishment, some of these teenagers with those raging hormones go berserk. I don't have a video of this up because I don't know which ones are the better ones, but if you wanted to go down that rabbit hole, you could easily go online to YouTube or something like that and look at how ballistic people go when their parents take away their video game systems, because that's part of this idea of this internet gaming disorder, right? So you could see it for yourself if you want. So now there are 4 or 5 categories, classifications of drugs, depending on what they do to your system. We have the first type here called depressants. These are drugs such as alcohol, barbiturates, which are tranquilizers, and opiates. Now, in Psych 2, when we get a little more specific, opiates are kind of their own category. But in addition to the euphoria, and in addition to the pain relief, it does slow the body down and make you feel really relaxed and kind of sleepy. So for Psych 1, we kind of lump opiates into this idea of things that shut your body down and make you sleepy, called depressants. They're increasing GABA and shutting down the central nervous system. Alcohol is the biggest type of depressant, and that's why it's increasing GABA, decreasing glutamate by default, and that's why the more you drink, the more likely you are to pass out, because you're literally telling your central nervous system to go to sleep. So alcohol slows down your neural processing and is a very potent sedative, especially if you haven't slept in a while. Um, it is something that if you continue to consume it every day compulsively, it can cause disruption of memories. It actually causes damage to parts of your limbic system that we haven't gone over because it's Psych 1. Um, and so it can have a long-term effect, something called Korsakoff syndrome, which is symptoms like Alzheimer's disease, but it comes from drinking. So it has a long-term effect on the brain. It causes brain cells to die, and um, those don't grow back, and it impairs your thinking. It even can impair growth of synaptic connections, which means that you're killing off the connections and killing off some of the neurons if you are an alcoholic and you continue to drink. But we see up here in bold that it says alcohol acts as a disinhibitor. Well, if you're inhibiting your system, how does alcohol act as a disinhibitor? And you may be asking, what the heck is a disinhibitor? Well, if you think about double negatives, right? Negative times a negative is a positive. Our brain, our frontal lobe, is actually inhibiting our behavior. You may want to, or may have wanted to, scream out, "You're wrong," when I said something about horoscopes or, intuition or things like that early on in class, but you didn't because your brain said, don't be disruptive, I could get in trouble, let's not do that. Well, you also are inhibited by your thoughts and your brain a lot of times. Oh, I don't want to tell that person I have a crush on them because I fear rejection. I don't want to get up on stage and sing karaoke because I'm not confident in my voice, or I get stage fright, or I don't want people laughing at me because I hate rejection. Wow, since the theme here. So it acts as a disinhibitor because sometimes you may have heard alcohol called liquid courage. So what we get is, somebody that doesn't want to tell this person how they feel, somebody that doesn't want to get up on stage and sing karaoke. All of a sudden, they take a couple shots of liquid courage, and here they are. Give me that mic. You can't stop me. Or truth serum, right? Comes out, and they just tell people their deepest, darkest secrets, including their crushes, without worries about normal inhibitions or future consequence. So right here at the bottom, it reduces your self-awareness, thinking that people are looking at you, or maybe you just don't care. Reduces your self-control, so you're not really feeling yourself. This is sort of the alcohol that takes over. Jamie Foxx has a song. You can blame it on the alcohol. Yeah, I can do that here. And it produces what we call myopia. Myopia just means nearsightedness, which means you focus in a lot of times on some sort of arousing situation and don't think about normal inhibitions or future consequences. You're not thinking about if people are looking at you and making fun of you. You're not thinking about if your person that you have an affection for is going to reject you. You're just going and acting on impulse because that part of the brain is inhibited. You're disinhibiting. So another example that I like to give in class is, let's say that you're, working in an office and it's Friday, and your boss decides to yell at you for something that you feel was not your fault and you were wrongly accused. And your boss has words with you that you don't agree with, and it's right before happy hour. And every Friday in the office, we go to happy hour across the street. So you go to happy hour, and you're still thinking about how you're pissed off at your boss, and you're a few drinks in now. So you are disinhibited, and you decide to go to your boss and have the words that you would have been inhibited and not done if you were not intoxicated, if you didn't disinhibit your brain. So all of a sudden, Monday morning, you have a pink slip or you have some problems because you spoke to your boss in such a manner. You were not worried about your normal inhibitions. You weren't worried about future consequences because you didn't think about them. Not a good idea, just saying for future reference. So as I said, long-term effects could be affecting the liver, psoriasis, not psoriasis, sorry, liver disease, um, and things like that. But as I said, your brain cells also begin to die off. So if you look at the picture above, you see on the right a scan of a woman without alcohol use disorder that has barely had, that many drinks in her life. And you compare that to the one on the left of a woman with alcohol use disorder. What you see is the holes in the brain, which is where our cerebrospinal fluid flows through, are huge and a lot bigger on the scan for the person on the left. We also see a lot of holes towards the top of the brain where there used to be more connections and more cells. And so alcohol not only affects your body, but it also kills off brain cells. And these are from MRI scans showing, again, brain shrinkage in women with alcohol use disorder compared to women that did not drink very much. So there you see it. When we talk about alcohol, people try to use it. We use it as a celebratory thing. We use it to cope with problems sometimes, which is not necessarily the best idea. But people think that whatever they do when they're, quote unquote, under the influence of alcohol, when they're shutting down or disinhibiting their system, is, whatever I do, I'm really not in control of my body. But the problem is, we see this from different people, right? And some people, I'm going to dispel some rumors or some myths for you. Some people think that depending on what type of alcohol you drink, it turns you into a different type of drunk. And we've all probably witnessed this, several different types of drunk. The happy drunk who loves everybody and gives hugs. The angry drunk who always wants to start fights. The pensive drunk who just starts to think about life and philosophize. Or the truth serum drunk, of course, right? Where people will tell you their deepest, darkest secrets, even though most of the time you never asked. Our social behaviors, and especially the biggest type of drunk, is the ones that say, oh, I can get a little handsy because I'm not really in control of my body. When we look at the attribution of social behaviors or sexual responses to alcohol, it's because it's releasing our inhibitions. But guess what? It's actually our brain that's still in control. And the type of drunk that you are is really based on what you think about your social expectations. So you become who you think you're supposed to be because of social expectations. Well, people get handsy when they get drunk, so I'm drinking, and that tells your brain, okay, let's get a little frisky, or things like that. If you are already in a bad mood and thinking about something, that myopia, that your boss was being a jerk to you, that may make you the angry drunk. So it's actually not something that the alcohol itself does, but it's the combination of that with your own brain, and it's your societal expectations that actually influence your behavior. There was a bunch of studies, you can see 14 intervention studies done with college students. And when this same lecture was given to college students who love drinking on the weekends and at night, right, frat parties and all of that, when they were told that their actions were still their own actions, and that it was based on societal expectations, and it's not just the alcohol that makes them do weird things, and they were basically made responsible for whatever they do when they drink, as the positive expectations of alcohol were lowered, drinking reduced by 50% in that next month overall, over all these 14 studies. Sorry, that's still your own behavior. You can't just, as Jamie Foxx said, blame it on the alcohol. So that actually really limited the amount of drinking, because people were like, whoa, you mean if I get in trouble for this, it's still my fault? Well, yes, and we know this from drunk driving, but this is different. No, it's not. So, again, hopefully I didn't burst too many bubbles there for you guys, but that's the truth. If people are alcoholics, we talked about the term substance use disorder. So specifically For alcoholism, we call it alcohol use disorder, and it is defined by tolerance, withdrawal, continued use despite knowing consequences, just like we talked about with addiction. We just call it alcohol use disorder if it is specific to alcohol. Moving on. Other types of depressants, alcohol, of course, being the most popular. Barbiturates are things that depress activity of the central nervous system. They are used, they're sort of horse tranquilizers, actually, originally. And they were used to reduce anxiety, because anxiety is the ramping up of too much glutamate in your system that can cause you to freak out, have panic attacks. But barbiturates can kind of sometimes go too far and impair memory and judgment. Potentially, if you combine something that shuts down your system with something that shuts down your system, combining barbiturates and alcohol, it's potentially lethal. So really, you got to be careful with that stuff. Other types of barbiturates, other names for them, Nembutal, Seconal, and Amytal. No, that won't be on the exam. I'm just listing them here. Opiates in this, again, Psych 1 book, are also listed under depressants because they do shut down or make you feel relaxed and calm down your system. So this includes opium and its derivatives. This is codeine, sometimes known as sizzurp. Yep, I said it. And of course, the ones that you get in the hospital, like morphine after a surgery, and heroin, which I have already talked about and used over and over as my main example for this chapter. Heroin was actually derived from morphine, and it was a street drug that was somebody developed in their lab that could be even more potent than morphine, if you can imagine that. Of course, it's highly, highly addictive, and pretty much right away. What opiates do, they have effects on the body, constricting the pupils, slowing breathing down, kind of like what we would see in the rest and digest parasympathetic nervous system, only to a bigger degree, and causes lethargy. If you're lethargic, you're tired, you're fatigued. In this case, you're just shutting down the system, so you're just feeling relaxed and tired. They're called or considered depressants here because they depress neural activity, they slow it down. Of course, they also lessen pain and anxiety. And if you do not continue your habits, withdrawal symptoms are pretty severe, a lot of pain. But again, unlike alcohol, heroin will not kill you. If you've ever heard the term kicking the habit, sometimes it could make the muscles fire, like or if you're in pain, sometimes people are sort of rolling around, writhing in pain. So if you've ever heard the term kicking the habit, unlike alcohol, it is better to quit this one cold turkey and try to get the withdrawal symptoms over with to help you to quit. So what they used to do, especially in the 1950s, is strap people down to a bed, and sometimes when they are going through pain and their muscles are firing, it can cause it to look like they're kicking. And so if you've heard the term kicking the habit, that was basically come up with, that was invented by looking at people who were recovering from opiate addiction and strapping them to the beds where they were literally kicking around. So they're kicking the habit. On the opposite end of depressants, we have uppers or stimulants, things that increase arousal level and things like that for the nervous system. So this includes stimulant drugs that you may not think of as quote-unquote drugs, like caffeine, or a lot of people consume every day, nicotine through smoking or vaping, and of course the ones that are more powerful, that are really the ones that people can consider stimulants, like amphetamines such as meth, yep, the blue stuff from Breaking Bad, cocaine, ecstasy, which is actually kind of a hallucinogen and kind of also a stimulant. I'll explain that as I go through. MDMA, also known as Molly, and of course methamphetamine. All of these things, amphetamines are sort of the performance-enhancing drugs that athletes used to take a lot, and sometimes still do, because they make you a little bit faster and more responsive, so they can enhance your performance when we have sports. I'm getting a little sad there. And they speed up your body function. So if you want a little more control of your body, you want to be a little faster, a little stronger that day. Amphetamines, at least the faster part, can enhance your performance. So what do? Remember the opposite of the opiate, which constricts the pupils, slows breathing. This one does the opposite. A lot of these stimulants involves dilation of the pupils, increase in heart rate, rise in blood sugar, drop in appetite. This is the same sort of artificially stimulating that fight or flight response in a way. Anxiety can do that too, but you don't really want that to happen. Can this cause anxiety or, stimulate anxiety too? Yeah, it can. And often it involves an increase in energy and self-confidence. So we also see this in people with bipolar disorder, as we'll talk about way later in the class, that have that euphoric self-confidence through the roof. And that is, of course, the chemicals causing that. Here's the other thing we see with stimulant drugs is an unintended side effect that people actually kind of like is that it causes a drop in appetite. You do not crave carbs, where somebody may do that. One of my favorite cartoon shows that I like to watch is Archer, and I remember a few seasons ago there is a girl character, a female character in that show that is overweight. Her name is Pam, and there was one season where they came across a big load of cocaine, and they were planning to sell it because they were no longer making money. But Pam kept getting into the stash, and this normally overweight cartoon character was all of a sudden very full of energy and got very skinny very fast. And that can happen when people are on meth or cocaine consistently. It can cause them to drop a lot of weight really fast. So companies actually made use of this idea. In the 1980s, there was a type of amphetamine called dexedrine, which was marketed actually over the counter for all those jazzercisers, called Dexatrim. And Dexatrim was basically a legalized form of speed of an amphetamine, and it worked to help lose weight because it made people not hungry. So that's what stimulants can do. And in the 1950s and things like that, a lot of actors and actresses, I think of like Lucy and Ricky from I Love Lucy, would smoke because smoking also helped to curb your appetite. So that's why also when people are quitting nicotine and quitting smoking, they tend to gain a little bit of weight, at least, because it's the opposite effect, and that's part of the withdrawal. So speaking of nicotine, it's the highly stimulating, highly addictive psychoactive drug in tobacco. Of course, the nicotine itself is not the most dangerous part, but all of the poisons that you're ingesting, including little bits of strychnine and rat poison, tar that goes into your lungs when you smoke. But the nicotine itself, what it does is it signals the nervous system to release a bunch of neurotransmitters, most likely, or the biggest of which is acetylcholine. And that's why, and in full disclosure, I've never smoked a cigarette, so I wouldn't know, but I've been told that people get a little bit of a tingling sensation in their muscles and in the periphery. And that's because if we have acetylcholine, as we talked about, that's the neurotransmitter that goes from the brain to the muscles to tell them what to do. So it makes sense that it would stimulate them. Again, it diminishes your appetite, it boosts alertness, it even slightly boosts mental efficiency, helps to calm anxiety, and reduces sensitivity to pain. So there is, nicotine as a whole is actually not completely 100% bad. There have been studies that have shown at least slightly that it does help in learning and memory. So people who smoke maybe while they're studying. Again, I don't recommend it, and the bad really, really, really outweighs the good in this case, right? Especially the fact that it leads to certain cancers, emphysema, which is lung problems, right, and things like that. So it's a really bad idea. But that doesn't mean that the nicotine itself is all bad. That's all I'm saying. Take it for what you will. It involves challenging acute cravings. Of course, you get withdrawal symptoms, very ornery. People lack concentration, and that contributes to relapse. In fact, there is in the UK, once a year, I don't know if they still do it, but they used to do a non-smoking day, and that actually increases workplace accidents up to 7%. Pretty interesting. So Why is it that it is so effective? And of course, it's also hard to quit because you can buy cigarettes anywhere, right around the corner at any 7-Eleven or any convenience store, liquor store, right? Any of those places. But the reason that it's so effective is because nicotine reaches the brain within 7 seconds, which is even double the speed of injecting heroin straight into your veins. Within minutes, just a couple minutes, the amount that is in the blood just soars everywhere. So we can see from this picture, it arouses the brain to a state of increased alertness, increases heart rate and blood pressure, which could be bad for potential heart attacks in the future. At high levels, it does relax the muscles and trigger release of neurotransmitters that may reduce stress. Um, of course, we talked about suppressing your appetite and reducing circulation to the extremities, so you feel a little bit of a tingling sensation. Um, Moving on, we have cocaine. Cocaine is one of those things that produces a huge rush of euphoria, and it's usually over with in about 15 to 30 minutes. And I've never done cocaine, but I can tell you that people are up, 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 and then that crash, from what I've heard, is pretty bad. And so in that case, a lot of times people will continue to cycle. And if you've ever seen these movies that portray cocaine users like Leo DiCaprio in The Wolf of Wall Street, they continue to cycle through. And why? They want to stay up, and they really want to avoid that crash at the end because it's a doozy, apparently. So people will just continue every 15 to 30 minutes to cycle and take some more so that they avoid the crash as much as possible. And of course, we have the same rules with cocaine as the other drugs, produces psychological effects. It depends on your dosage and form. And again, how you act on cocaine is, again, like alcohol, based on your expectation, your social expectations, and your personality. And definitely when we talk about disinhibition, if you're way up there, self-confidence increases, energy increases, you may think you're king or queen of the world, right? So that's cocaine. Um, so we just talked about cocaine, methamphetamine, meth, the blue stuff from Breaking Bad, my favorite all-time show, also produces those same effects. And this one is powerfully addictive. If you guys have seen the new Netflix show Tiger King, you can see that meth really messes up your teeth. This is what they call meth mouth. And it's not a good drug to be addicted to, obviously. So proceed with caution, as I say. This is a cautionary tale. Ecstasy is known as MDMA. On the street, it's known as Molly. Most of the time on the street, from what I'm told, again, another drug never tried, and never will, that it works as a stimulant because it enhances all 5 of your senses. So it stimulates, increases sensitivity to all of your senses, especially your sense of touch. So a lot of times people use this as their drug of choice at a rave, and a lot of people choose to suck on a pacifier because one of the side effects is grinding your teeth, and you may be grinding your teeth so much that you break them. So the pacifier works to keep you from grinding your teeth, and because your sense of touch, and especially in the mouth, is heightened in this case, it also probably feels really good to suck on a baby binky. So MDMA is a synthetic stimulant. It is known as a stimulant or sort of a hybrid because it's also a hallucinogen because it increases your senses. It also is producing this sort of hallucinogenic effect where it's telling your brain that it's stronger than it really is. So that is stimulating it, and it's a mild hallucinogen. So it produces a sense of euphoria, but a lot of times the MDMA concentrates in your spine and can cause posture and spinal problems even after the first dose. And the longer you use it, the more harm that can come to you and causes problems in thinking, cognition, processing of information over the long term. So the last category we have are hallucinogens. Hallucinogens are defined as any sort of chemical that distorts your perceptions and calls up sensory images without any actual input from the senses. If I go back to MDMA for a second, the fact that it heightens at least 4 or 5 senses also means that it's probably causing increases in the thalamus now that we're putting all this stuff together. So hallucinogens distort your perceptions. They make you trip out. You may see color trails. You may see still pictures that look like they're in motion or animated. You may see just distortions of things. You may hear voices that aren't really there. And that's what hallucinogens do. A lot of times they work on the serotonin system, like mushrooms, magic mushrooms, and LSD. Those are serotonin agonists. Marijuana, though, is probably your number one. It's a mild hallucinogen, which means it doesn't make you trip out all that much, but there are effects like distorting your concept of time, where it feels like it's been 8 hours, and really it's only been, 10 minutes or something like that. So what is it about marijuana? Well, marijuana has leaves that contain the active ingredient that makes you high called THC. And you may not know this, but THC stands for delta-9 tetrahydrocannabinol. Yep, try and say that 10 times fast. So it's usually smoked, eaten, maybe sometimes put into tea or alcohol, and it produces an increased sensitivity to certain colors, sounds, and tastes, sometimes smells, and it seems to linger in the body longer. For those of you who are applying for jobs, just to let you know, in case you wondered, about 28 to 30 days, so about 4 weeks, about a month to leave the body if you have to do a drug test. Just saying, putting that information out there. It can relax people, disinhibit, impair motor and perceptual skills, and of course your reaction time. So not only your concept of time, but actually your reaction time. Playing video games, driving, this is why it's just as bad, if not worse, than alcohol when you're driving, because it impairs your decision making. If you need to quickly react to step on the brake, good luck with that if you're under the influence of marijuana. At this point, it's usually here where we have a sort of little debate, if we have time, on legalization of marijuana and whether the good outweighs the bad. Some of the pros that I've gone over in other classes that I'll share with you is it can be taxed pretty high, so it brings money into the local government, city, state, county, city, county, state, I guess we would say. That on the street, there's no control over what they lace it with or put in, or regulating. And in this way, at dispensaries, the government can regulate. And of course, there's the medicinal properties of marijuana, which allows people with chronic pain or terminal illness or things like that to be able to get some relief. And it is not as addictive as some of those other drugs. It's more of what we would call a psychological addiction than a physical addiction. So the withdrawal symptoms are very mild. That doesn't mean that you can't be addicted to it. It just means it's not nearly the same. Plus, one of the biggest benefits of marijuana is that nobody's ever died from a marijuana overdose. I don't know if it's even possible to overdose from marijuana. What it does is it activates directly the CB receptors, cannabinol receptors in the brain, which there are CB receptors for an endogenous chemical in your brain called anandamide. You don't really need to know what an anandamide is or does for this class. We can have a separate conversation later if you really want to know. But yeah, for all intents and purposes, that seems to be the only other chemical, THC, really that binds to these CB receptors. So people who are more of the hippie type may argue that it's meant to be put into your brain because there is receptors that specifically are there for it. You take that however you want. I'm not going to debate that one. So that's marijuana. I think the good outweighs the bad in terms of legalization, but of course, a lot of caution should be used and kept away from children and all of that fun stuff. So since we don't get to have that debate, here we are. LSD is a powerful hallucinogenic drug. LSD stands for lysergic acid diethylamide, another mouthful. So you can stick with LSD if you really want. And it interferes again with serotonin. Um, it causes an increase in serotonin, which seems to cause this trippiness, trails, and a lot of times it's visual hallucinations, sometimes auditory. You may hear things that aren't there. Most of the time it's interfering with the visual system. So people under the influence of drugs can often see a bright light in the center of their field of vision, which you might be able to get from this, a little bit from this graph, this picture. Um, of course, if you stare at this while under the influence of LSD, you may see a lot more than this, right? Um, so marijuana itself has also been synthesized. There have been chemicals or drugs synthesized to be maybe a little more powerful, a little more controlled, called K2 or spice. These contain, sometimes there is, I think it's salvia, which is um, what's his name, Michael Phelps was caught with a couple years ago, a few years ago now. Um, it contains THC and it's sort of a mix of effects, so it's a little more enhanced from just your standard marijuana effect. Can relax, disinhibit, and even produce a bit of euphoria. It's considered a mild hallucinogen, but it amplifies sensory sensitivity. So again, it may be calling up um, or exciting the thalamus. It impairs your motor coordination, perceptual skills, reaction time. As you can see, it impairs your brain development. Do not use marijuana or its derivatives if you're pregnant. That can cause birth defects. It can cause problems in neuronal development and linger in the body for weeks at a time, as I said. So as we're winding down, because we've gone over the 4 categories of, I guess 3 categories really. Again, opiates in Psych 2 is its own category. Why is it that people become users of consciousness-altering drugs? Well, think about the time that we're in right now. We talked about the 3 sort of ways that we look at psychology. We have these biopsychosocial scales, right, or axes. So biologically, it's genetics. When we talk about nature over nurture, if you have parents that have been addicted to substances like alcohol or drugs, then that doesn't mean that you will, but it means that your chances genetically of becoming an alcoholic are much higher. So some people may be biologically vulnerable to particular drugs like alcohol. And we also have systems where the effects of a drug may be greater to people who metabolize it more. Some people may be resistant to it because their metabolism of drugs, they may drink a lot of alcohol and it barely does anything except makes them sick. Those people are not probably going to become alcoholics because the good does not outweigh the bad. Of course, we see a lot of psychological factors like, oh, I don't know, being stuck at home, right? This can cause a lot of people right now, if they have the supply, to probably use and overuse, use and abuse. So things like stress, depression, hopelessness, social factors like peer pressure combine and a lot of times lead many people to experiment with and sometimes be addicted to drugs. Social factors, peer pressure, people pushing it on you and you don't want to be seen as a square. I don't know if people use that term anymore. I don't think people in my generation use that term, but we know that culturally that it's used, especially alcohol, as a celebratory tool. Cultural and ethnic groups have differing rates of drug use. Native Americans use peyote in their ritualistic ceremonies and things like that, which is hallucinogen, mescaline. Drinks are used to celebrate birthdays, bar mitzvahs, right? Weddings, Friday, happy hour, right? Could just be the time of day. There's a lot of rituals. When you get together with people, you go out for a drink. When when businesses do mergers and go into business with one another, drinks, right? So it doesn't matter what type of influence, whether it's genetic, biological, whether it's psychological, or social cultural, there's a different path that is offered for drug misuse prevention, and we have different treatments for different things. Narcotics Anonymous focuses on the drug effects. Alcoholics Anonymous, AA, is for alcohol. Again, we talked about Sex Addicts Anonymous. Well, we didn't say that, but Sex Addicts Anonymous, Gamblers Anonymous, right? There are different ways for the different types, different programs, different treatments for the different types of things available. One of the things that I like to keep in mind, I'm never able to talk this much because usually the period's over by the time I get to this slide, but there's no rules here. And so different programs are available, different treatments are available, depending on what your motivation is. Sometimes people aren't motivated to do it. You know, their family forces them into it, into a rehab and things like that. Those are going to be the people that are most likely to relapse and go back into it. If people realize what they're doing to their families, what they're doing to themselves, and they really get the motivation to try to quit, and now they have the help available for them, that seems to be the best outcome. So a lot of these, sometimes we give medications to take with the drug to try to counteract the effects. If you've ever heard the term methadone clinic, that was actually a bit of a to combat opiate addiction, where they give people a partial agonist of opiates, so hoping that they can reduce the dosage because you're giving them a little more. That didn't necessarily work the way that they wanted it to in the 80s and 90s, but sometimes methadone clinics are still around. For nicotine, you've probably seen the patch or the gum, which is another stimulant. You're giving them a little bit of nicotine, so hopefully they can wean off of it. This may be a little more effective because nicotine isn't as strong or powerful as opiates. But again, one of the questions that has been prompted is, and just sort of stimulates food for thought for you guys, is that even though these different drugs work on the different neurotransmitter systems, again, nicotine is more acetylcholine, cocaine is more dopamine itself, and norepinephrine. We see alcohol with GABA. We see, hallucinogens like LSD with serotonin. All of these different neurotransmitter systems, the cannabinoid receptors for marijuana and THC, and yet the one thing that everything has in common, including non-substance, is that dopamine pathway. So why don't we try regulating that dopamine pathway? Well, one of the things that we have as a sort of cautionary tale is one of the things I talked about with dopamine that goes into the basal ganglia, which is a little set of neurons, clusters of neurons right below the frontal lobe, or on the inside, is that too much dopamine in that area, a little bit too much dopamine causes the positive symptoms, hallucinations and delusions in schizophrenia. Too little, as is controlled by medication, causes the Parkinson's-like symptoms. So maybe there is a fear that if you can't regulate that dopamine system to the pleasure center, reward center, correctly, it may lead to more harm than good. So that's just something for you guys to think about. An example is alcohol. There is a drug called antabuse, which basically doesn't allow the alcohol to metabolize. So what that means is when you drink, you get all of the bad things, the hangovers, the throwing up, and all of that. But because the alcohol can't metabolize, guess what? You don't get the fun drunken stuff. So the point where people drink to feel that intoxication or lack of control, you don't get that. So a drug like antabuse, people try, use it, and they take it before they drink, and all they get is the bad stuff. So if you've ever heard somebody that has gone on a bender all weekend and they wake up really hungover one morning and say, I'm never drinking again, well, basically that's what antabuse is trying to do, is produce that and try to make that connection in the brain that I'm only getting the bad stuff and none of the good stuff, so maybe this is my reason to quit. But if you don't have the proper motivation with it, people can just not take the drug with it and keep drinking and get the same effects. So it's an interesting dilemma that we're still working on to this day, and hopefully that stimulates some thought for you guys. That is chapter 3. I'll see you guys soon. Have a good rest of whatever it is you're doing. All right. Rest of your day, rest of your time, whatever it is. Talk to you soon.